Hey everyone, have you ever looked at a CT scan and an MRI scan and wondered why do they look so different? Today we are breaking down the key differences between CT and MRI image contrast so you'll never be confused again. By the end of this video, you'll understand how CT and MRI create contrast, when to use one over the other, and real clinical examples of contrast differences. Let's dive in. First, how CT image contrast works. CT scans create contrast based on X-ray attenuation. Different tissues absorb X-rays at different rates and is measured in Hounsfield Units or HU. For example, bone absorbs more X-rays, giving it a higher HU value, typically a few hundred, making it appear bright on CT images. Air absorbs fewer X-rays, resulting in a lower HU, usually around -1000, making it appear dark. Soft tissue, which has a water-like composition, has an HU close to 0, and the HU of water in CT images is 0. Key factors affecting CT contrast are 1. Density and atomic number. Higher density equals to more X-ray absorption and equals to brighter appearance on CT. And 2. Use of contrast agents. Iodine-based contrast is commonly used in CT images. It enhances blood vessels by increasing X-ray absorption, making them stand out more clearly. Here are some example CT images. You can see that on the left is the CT image in the abdomen area. The bone appear brighter on the CT image. Soft tissue such as the liver, the kidneys, they are on the medium range. And some gases in the bowel, they are air-like, so they appear dark. We also know that there are some contrast is used in this image so that some blood vessels in the liver and kidney, they appear brighter, make them stand out more. And here on the right is a CT image of the thorax area. We can see the lung, which is mostly air, appear dark. The bone is also bright. In this case, we are focusing on a very narrowing window, and therefore you do not see much difference, less difference between bone and soft tissue. This is because we are focusing on a narrow window, focusing on the lung area. And here we can also see the lung vessels and also the tumor in the lung. Next, how MRI image contrast works. MRI doesn't use X-rays. Instead, it measures how hydrogen protons interact with a magnetic field. MRI scanners typically use a strong main magnetic field, for example, 3 Tesla, along with gradient magnetic fields to encode positional information and form an image. The two main MRI contrast mechanisms are T1 and T2. On T1 images, fat is bright and water is dark. And on T2 weighted images, it's reversed. These contrast differences result from native tissue hydrogen characteristics, which can be enhanced or suppressed using different pulse sequences. Key factors affecting MRI contrast are 1. Tissue composition. Water-rich tissues have different relaxation times than fat-rich tissues. And 2. Use of contrast agents. Gadolinium-based contrast shortens the T1 relaxation time, therefore making certain tissues appear brighter on T1 weighted images. And here are some example MRI images. On the left is the T1, in the middle is the T2, and we can see that on the T1, the CSF, which is water-like, is dark, and it appears very bright on the T2 image. And the fat, the white matter, is brighter on the T1 compared to the T2. And on the very right is a special case of T2. It's called T2 FLAIR, which stands for fluid attenuated inversion recovery. So this pulse sequence particular suppress the CSF, and therefore you can see the CSF appear dark on this T2 FLAIR image compared to a regular T2 image. And T2 FLAIR is usually used to enhance edema so that it suppress the fluid to make the edema appear more obvious. And here is another example of the T2 FLAIR, and we can see by suppressing the CSF, and we can see the edema better. Here is a quick summary of the key differences between CT and MRI contrast mechanisms. In essence, CT uses X-ray attenuation. Higher X-ray absorption, such as bone, appears bright, while lower absorption, such as air, appears dark. MRI uses the proton relaxation times. The tissue contrast depend on the T1 and T2 relaxation properties. In terms of contrast agents, iodine is used as a CT contrast agent because it increases X-ray absorption, making vessels and certain tissues brighter. Gadolinium is used in MRI because it shortens the T1 relaxation time, making the tissues appear brighter on T1 weighted images. A rule of thumb: use CT for fast imaging such as trauma, and it's also good for detecting fractures or lung disease. Use MRI for detailed soft tissue contrast such as brain imaging, muscle evaluation, or tumor detection. Here is an example of MRI versus CT images side by side of the prostate cancer. And we can see that in this case particular, the MRI has better soft tissue contrast, and therefore we can see the boundary of the prostate with the bladder very clearly on the MRI image, versus the boundary is not as obvious on the CT image. However, when we want fast imaging, such as in the trauma cases, CT is very ideal because you can perform a whole body CT image in less than a minute, while MRI will take much longer. And you can see that on MRI, you don't see the bone signals because bone has very few hydrogen component. And MRI mainly explores the hydrogen interaction in the magnetic field to extract image contrast. So thank you all for watching. And there you have it. CT and MRI provide different types of contrast, making them valuable for different clinical applications. CT is best for bone, lung, and emergencies, and MRI is best for soft tissue, brain, and detailed imaging. Which modality do you find more interesting? Drop a comment below. Thank you all for watching. See you next time. Bye.